Welcome. My name's Elise Gordon, and as I said before, I'm a speech language pathologist or a speech therapist or a speech lady or a hey you or whatever you want to call me. I answer to that. So like Susan said when we were talking about a little bit of a meeting today or a topic today, we couldn't really think of anything specific. And I said, well, I can just talk for hours on this topic because this is like really my favorite, but you guys don't have to stay here for hours and hours. But everybody can hear me okay? Yeah. So we called it Speech Therapy for Dummies, everything you wanted to know about speech language pathology. So I'm going to talk a lot about what we do, what kinds of patients or people we work with in the community, what other things that we do that you may not realize that speech pathologists do. And then I'm going to leave a lot of room for questions because I think that, I could talk for hours, but I want to hear what you guys have to say. Okay. So, so just let me see if I can move this for a second. Okay, perfect. So just in case you're not 100% sure what a speech language pathologist is, it's a health professional who works with people of all ages who have communication and or swallowing problems. And I liked, so on PowerPoints, I don't know if you guys have developed PowerPoints in the past or recently, but they have these new things on the computers where you can design pages. And I picked this particular design because it reminds me of like your trachea, where your vocal folds are, and our vocal folds move together in a wave formation, kind of like a harp or stringed instrument. And when I look at this picture right here, it reminds me of your trachea or your vocal folds. I know I'm a really big speech nerd, so the fact that I'm looking at this and saying, oh, this looks like the vocal folds, I should definitely throw that on there. So that's where we got this from, but I just wanted you, it reminds me all of the nerves and the muscles have to come together to produce voice. And obviously it's right on top of where your lungs are. So you need a nice open area to breathe, but you need them to also come together to close to make sound. So that's just interesting. So I just wanted to tell you a little bit why I chose this particular picture. It looked like muscles to me. So as a speech language pathologist, we're university trained, and we can diagnose, manage, and treat various speech, voice, and swallowing issues, obviously for any age. I never really took to being a speech therapist with children. I did it for 5 years when I first started because I had just moved to Philadelphia, Pennsylvania from upstate New York. And I was young and I had one friend in the city, and that's where all the young therapists went and worked. So I said, well, I can do this for a little while, but I didn't love it. I worked with 3, 4, and 5-year-olds, and I really felt like I would much rather encourage an older person to come work with me than discipline somebody else's children, which is, there's a lot of speech therapists, thank God they're out there, who love children and couldn't ever think about working with the adult population, but that wasn't where my passion or my heart is. This is where it is. So after 5 years, I flipped to adults and I never looked back. But that's what we did. But I've had lots of different interesting patients and clients in my life with lots of different disorders and things. So I really feel like, again, that speech therapist, we get to do all the fun things because we can work with lots of different people. And it's like being a detective. So we can figure out why your throat isn't working and why your muscles aren't coordinated. And, just a reminder to everybody, I'll say it again and again, if your legs are weak, your throat is probably weak as well. So we kind of get left out. It's like always the physical therapist, right? That's where all the, oh, you need PT. But I kind of feel like, yeah, but you need speech too, because if the legs are weak, the throat is weak too. So just food for thought out there while we're finishing lunch. So as I said before, we can work in schools, college clinics, universities, acute care hospitals, inpatient and outpatient rehab facilities, clinics, residential healthcare facilities such as like an assisted living or a skilled nursing facility, or non-residential healthcare facilities like an adult day program, which currently is what I do when I'm not at Parkinson's Place. I do visit people either in their homes or at assisted livings or adult day programs, and I provide speech therapy for lots of different reasons there. So we can help you when you have a range of speaking, communicating, or swallowing problems due to conditions such as, children with just a normal speech delay, or people who've had brain injury or strokes. And we work with people of all ages, like I said, in all different settings. You'd be surprised. There's a speech pathologist in every hospital and every neonatal intensive care unit teaching them how to suck and swallow, from the tiniest little babies, the newest persons alive, to the very, 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 very oldest people who live. I've had clients who are 109 before. So if you're like, I'm feeling a little bit old because I'm turning 50 this year, but then I think about my 109-year-old lady from a couple years ago, and I'm like, hey, I got it made, right? So, so that's kind of the fun things that we get to do. We have knowledge and skills and expertise to provide high quality clinical services, and we engage in ongoing professional development to complete certification. So as a speech pathologist, we do have a master's degree. That's entry-level position. A master's degree is definitely required. Sometimes people teach in the schools for 5 years without a master's degree, and that's kind of being like grandfathered out. When I graduated from undergraduate degree in 1996 from Ithaca College in upstate New York, I had a degree in teachers of the speech and hearing handicapped, and I had my New York State teaching certificate. I took an extra test, and I did do an internship in a school setting, and I didn't love it, but I thought I might as well take it just in case. It's right there, take it. And then, so if you wanted to work for 5 years without your degree, as long as you were going to become master's level certified, then you could teach. But I went straight on to Syracuse University for my master's degree, and that was also in communication sciences and disorders. And then speech therapists as a group, we do a really cool thing as an organization. We have a national organization, which I'll talk about in a few minutes. That's our regulating and certifying body. And they also lobby for us on Capitol Hill. They're based in Washington, D.C., and Rockville, Maryland, actually, but they started in D.C. Just as a group for interest in Medicare reimbursement and governmental issues around insurance reimbursement and taking care of patients and healthcare. But as a speech pathologist, you get something called your clinical certification, or your C's, your certificate of clinical competence. And ASHA, the American Speech and Language Association, is the governing body, and they send you your C's in the mail. It's a pretty exciting day. So if you're ever looking for a speech language pathologist, you really want to make sure that they have the master's degree, and then we have this thing next to our name, our credentials, called the CCC-SLP. You can get your C's in audiology as well. They're the governing body for that, but that's really important. There's ways around not having your C's and still being able to treat and bill Medicare and other insurance companies. And I say Medicare first just because all the other insurances follow Medicare, so it's just easier to say Medicare. But all the other commercial products out there do follow Medicare's rules and regulations. So if you're looking for a speech pathologist, definitely make sure they have their C's, because ASHA, which is the body that I'm talking about that regulates, they make sure that we do our annual dues. They make sure that we do our continuing education. So every 3 years, we have to do at least 30 hours of continuing education. And they also make sure that anything that is new to the field, they make sure that you're aware of. And so it is definitely something that you want to make sure that the therapist that you're working with is certified in. And then, like I said, so speech pathologists do something different than physical and occupational therapies, which I'm super proud of. Some people don't love it, but I do. And that's that we work through ASHA, which is the American Speech Hearing Language Association. But after we graduate with our master's degree, we do something called a clinical fellowship year, so a CFY year. And what that does is it's an independent therapist. They can go and bill insurance and treat patients independently, but for like 9 months, you can tell that the profession is 99% women, because they thought about it in a 9-month increment, which, it's like having a baby. You do your clinical fellowship for 9 months, and you have a supervisor for 3 different trimesters, is really kind of what it's like. And they come out and they observe you, they they watch your documentation, they give you support and supervision, and it's kind of a really nice bridge between just having your master's degree and being a fully independent speech therapist. So someone who would like I've supervised about 12 or 13 in my 28 years of being a speech therapist. It's something that's really good to do for the profession. You don't get extra pay or anything like that. You just do it for the love of the community and to help out the next generation of speech therapists. So physical and occupational therapists don't do that, but speech therapists do. And I think it's a really nice thing that they instituted because it gives you the confidence as a new grad to be able to operate as a professional. So like I said, once your graduate work's been completed and you do your CFY year and you go for your permanent certification, you get your C's, and then what? What do you do, right? So we're gonna talk about all the different types of diagnoses and things that you need to be aware of, but just a real quick history lesson. Speech therapy has been around as a profession for the past 75 years approximately, starting in the 1950s or so. In the beginning, there was no requirements for education, standardized assessments, schooling, and then around the 1960s, assessments started coming. And believe it or not, there's a couple assessments that we use with aphasia when you lose your language due to a stroke or a brain injury that were created in the 1960s that we still use today because it's so great. They got it right. So I talked about ASHA, and they started in about 1925 informally, and in the beginning they had 25 core members, but they are really the ones that are instrumental in initiating the development of recognizing speech pathologists as a core profession and a scientific field. And today there's over 234,000 ASHA members, and that is the people, like that's not just all the members that have been part of ASHA in its entirety, that's just how many we have right now. So if you've retired and you decide not to pay for your C's anymore, they kind of fall off, but there's still 234,000 members, which just makes me giddy. I don't know, there's like a lot of us. And that goes, the ASHA goes for United States and Canada, that we share a membership there. So the national office has moved 4 times, and right now they're in their biggest, best building since 2007 in Rockville, Maryland. And they are on purpose, like I said, in Washington, D.C., to fight for better reimbursement for services provided. So we'll flip to that. So we check how you communicate and we check how you swallow. And I don't think people really realize that swallowing is part of our profession, but it's the same muscles you use to breathe and to talk, right? So it's this. So we're the experts in
speech
area. So we're responsible for the swallowing skills. It's the same anatomy. And again, if your muscles and your cheeks and your throat and your legs are weak, your arms, then you might have trouble coordinating, chewing food, moving it from the front to the back of your mouth, and then initiating the swallow. And the reason why we're so big on making sure that we swallow correctly is because it's right in that same location where your lungs are. So if you don't swallow appropriately, what happens? You aspirate, right? It goes right into your lungs. Right at your Adam's apple or your larynx, you can feel it. It sits right on top of your vocal folds, which sits right on top of your trachea. So when we swallow, our muscles close off and they move out of the way. When you have a good, complete, coordinated, strong swallow, the vocal folds slam together. They have another muscle that comes down and closes it off, and it moves your larynx, your whole Adam's apple. That's what you see goes up and down when you swallow, especially if you're a gentleman and we can see you have a big Adam's apple. And it moves kind of up and out of the way so that the food goes down and goes into your esophagus. So it goes into your stomach so that you don't aspirate. And if you aspirate, you have foreign body in your stomach or in your lungs, then you get pneumonia, and that's not good, right? Like obviously if you're having weakness and coordination issues in other parts of your body, we don't need pneumonia on top of it.
It's for patients.
So sometimes when we aspirate, speech therapists come in to treat people. They do strengthening exercises, right? On Mondays, we have class that strengthens our vocal folds and our breathing for speaking or voice, but it also has a secondary purpose, and that's to help your swallow. So we can do that. We also can change diets. Sometimes you've heard of thickened liquids that nobody ever wants to be on. It's not fun. Like, as anybody who takes my classes know, I'm a big coffee fanatic. And if you're going to thicken my coffee, I'm not going to be very happy with you. However, sometimes it's good. You thicken up liquids, they go slower, and your muscles can gather together and make the appropriate movements so that the liquids go right into the right spot. A lot of times, if you work with speech therapy, we get you stronger, we can get you off of thickened liquids or give you some fun things that you can try with thickened liquids that makes it a little bit more palatable. But again, if you thicken my coffee, I'm not going to be real happy with you. Just saying. So we're talking about swallowing, huge importance with swallowing. And like I said, there's lots of different exercises, maneuvers, compensatory strategies that we can do to help you, and that's all to help these muscles come together, move out of the way, and give you a good swallow. Has anybody had trouble swallowing before? Yeah, but we fixed it, right? Yeah, but you know that there are some things sometimes we avoid, right? Certain foods we avoid. Maybe like popcorn and peanuts sometimes are real nasty. No, those are good for you. Everybody's different.
Spagama, right?
You like popcorn? I have trouble swallowing popcorn because it gets stuck in my teeth. It makes me nuts. So everything is to rule out or to waiver off aspiration. No one wants pneumonia. If you guys can hear me at home, if you don't mind muting a little bit. And then we can unmute for questions later, if that's okay. Thank you. So swallowing's huge. Lots of different diagnoses have issues with swallowing. Parkinson's is one of the ones that are on the radar for that. Not everybody who has Parkinson's has trouble swallowing, but it might be something that if you do live with Parkinson's disease, that it might be something that you have awareness to. But lots of different diagnoses have difficulty with swallowing, including stroke, sometimes just overall weakness, sepsis, irregular infection. Sometimes people who have open heart surgery have difficulty swallowing because there's a really big cranial nerve that comes up through your chest, believe it or not. And if that gets impaired, or sometimes when you have surgery, you have trauma there, your vagus nerve, the cranial nerve number 10, it's not surprising if you have heart surgery that you might have a little trouble swallowing after, but the speech pathologist who's in the hospital will help you there. And a lot of times, like I said, with exercise and some modification, sometimes people need to tuck their chin down and that works better for them. Sometimes you need to turn to a affected side. Sometimes the thickened liquids works really well. Sometimes just having wet food works well. So you got to find your groove with it, and then consult and keep, if you do something a lot and you're still having trouble, come back to us because maybe we'll try something different. But that is hugely important. So some other things. So anytime you work with a speech pathologist and they do speech therapy, they develop a treatment plan that's individualized for you. It's one-on-one therapy, typically not in a group. Sometimes there are some settings where they do speech therapy in a group, but typically it's one-on-one. And it involves either exercises for strengthening or exercises to stimulate your brain, because we do a lot of things with cognition as well, which is probably the newest scope of practice we have is cognition. So like I had said before, one of the best things about speech and language pathology for me especially, but anybody else, is that say you're just in a rut, like after COVID, I was working in a facility for 11 years as the director of rehab, and I had enough and I needed a change. I didn't have to change my profession. I just changed the setting where I worked. So I think that speech therapy is a great profession because you can just change your setting. If you need a change, 28 years is a long time to be a speech therapist, right? But you just find a different setting or you find a different group to be with, and then you get excited and passionate about working again, which is what has happened to me. So we help young children usually form sounds with
That's what they do.
articulation, but we also help people speaking clearly and more easily communicate. We strengthen muscles. We help increase people who are having trouble word finding, having the words. You have the word on the tip of your tongue and you just can't get it out. Sometimes if you're having issues with your organization of your thought, we can help you with some compensatory strategies to get words out sooner. And we help people improve the way they put words together. So, communication and socialization is key, right? We learned a lot about that during COVID when we were isolated, especially like how important it is to communicate with each other, right? And so when your communication is impaired, what happens? You get frustrated, right? We all get frustrated. We talk about our frustrations. And then what do? We stop what? We stop communicating or we stop talking. And once that happens, then it's kind of like a bad cycle. We have to break the cycle. So that's what we're here to do, to maybe help think about things a little different, help give some compensatory strategies, help your muscles work better. But I do feel like a lot of times I'm a detective. When I first meet you and I don't know what's going on and you're telling me all these symptoms, I act like a detective. I ask a lot of questions. And sometimes I irritate a lot of people, especially when they're not feeling well. And I'm asking you a lot of questions like, did you do this? Or when did you do this? Or what happens when you feel like this? And so, then they always say, well, can I ask you questions? So my thing with all of my patients or my members or my guests is that if I ask you a bunch of questions, you can ask me a bunch of questions. And that kind of levels the playing field a little bit.
Which dog is this?
Sometimes we help people with alternative augmentative devices or augmentative communication. So we're living in this technology world, which is just so amazing. You can have a communication device right on your phone. Like I help a gentleman who's 36 who had a stroke and he can talk through his phone. He pushes buttons. You can get an iPad that can help you talk. And then with my not my normal job, my day job, I call it, my other job, I do sometimes meet people over telehealth on the computer. And I'm working with some people who are significantly deaf, profoundly hearing impaired. And there's this really neat device that insurance will cover. And it's just a device. We're not connected to the company. I work for Fox Rehabilitation, and we're just working with this other company that produces this device. And for insurance to cover it, a speech pathologist has to evaluate you and say, Rick, you are appropriate for the device. And it's a really neat device because it can help someone do two-way communication without like a phone that's dependent on Wi-Fi, right? So if the Wi-Fi, the internet's not working, then you can't communicate over the phone sometimes, and that's frustrating. So we're working with getting this device into the hands of people who really need it. Like over telehealth last week, I met a single mom who was my age, has a 16-year-old just like me, and she's been profoundly deaf since she was born. Her mom was sick with German measles when she was born, and she has no other significant health issues. She just doesn't have hearing. She's not able to hear. And she's really frustrated because sometimes when she takes her son to appointments, she lives in a new environment, a new town in Sebring, Florida. There's not enough people who can sign with her. And she said pen and paper is so uncomfortable and not natural communication. So this UB Duo device, she'll type into the device and it will print it out on the back, and then the person can sign or type back to her. And she's just so excited because it's going to be really life-changing for her to help her communicate. And she has social anxiety about being out and not being able to communicate. So we're hoping with this device, it will help her to communicate that way. And it's not a device that's something she could afford on her own. It's about $4,000 private pay. But if we put it through insurance, they'll pay for it as long as a speech pathologist like me says, yep, she's appropriate. So I tested her skills. Her motivation is very high. She will definitely use it. But that's some of the fun things that I get to do, once in a while. That's different than what you think of like a speech therapist does get to do. So I wanted to tell you about it today just because you have a bigger awareness of all the different things we can do. But more than not, what we're really here to do is improve quality of life and decrease burden of care. So we do a lot of patient and family education, caregiver education. Maybe it's something, you're at home, you're struggling with this, tell me, and then I tell you maybe something, try this, try that, or come to the home and help you do that. So where else? I put everything into this slideshow because I was just so excited when I was writing it. So carrying on conversations, taking turns in conversations, not being distracted is hugely important. We can work with
22nd,
that.
2014 would be 10 years old. That's Maggie.
We
June
can also
22nd,
help people with limited or no
2014.
ability to speak.
That's Maggie.
She'll be
Hey
10 years
guys, if
old.
you're at home listening, if you could put
Past
yourself on
June
mute, I'd
27th.
appreciate it. If you can hear me
That's
over there at
Maggie.
home, I know there's a lot of you who are, there's about 10 people Zooming
She's
from
10,
home. If you could
and-
mute, I would appreciate that. All right.
Bam Bam.
Anyway, so we can train family members to use compensatory strategies or caregivers or
one and
anybody who's in the
15.
home to help use
She's
devices or
nine.
the strategies.
9 and 10.
But-
That's what they
Provide
are.
articulation therapy to
They
young
just both had
kids. Hopefully
birthdays,
it's
June,
fun, because if it's
July.
not fun, it's not worth doing, right? And then we also provide, like I said, oral motor or pharyngeal throat strengthening exercises to help with voice and communication and swallowing. Lots of diagnoses, adults, children, strokes. Head and neck cancer is another area where people have specialty with, where sometimes we'll do some speech therapy before they might have surgery or before you might have radiation to your neck, because when you have radiation, it does affect the fibers in your neck and the musculature there. So we can train you to how to swallow better before you have surgery or before you have radiation treatment. And that really does help the transition, because you know what's happening. We make the muscle stronger even before we go to that level or that treatment, and that is like significantly better for your quality of life once you're already through the changes that happen after you have radiation or surgery or chemotherapy sometimes. So we can treat people with aphasia, which is difficulty talking after a stroke, articulation disorders, young children who stutter, that's very life-altering. So we can help them maybe do compensatory strategies to get out of the stuttering behavior, because that's socially difficult for kids sometimes. Voice and resonance disorders, so you're having difficulty talking, you're having difficulty modulating. We work on that a lot here with our Speak Out program, but also on Mondays with our exercise class. Swallowing disorders, dysarthria, which is when the muscles are weak, and so we work on that, but it makes your muscles sound slurry and you have difficulty with intelligibility. Auditory processing disorder, sometimes people have trouble understanding written words or spoken words. And then, like I said, cognitive linguistics disorder. So this is something that you don't think that speech therapists do, but we do work on cognition. If you can't attend to task and you're distracted by something else, it doesn't matter what you do. You're not going to pull in information from your environment. And I always equate it. So I had an audiology class in graduate school that was at 1:30 in the afternoon. It was right after lunch. And it was so boring. Like the ear itself, to me, was just disgusting, boring, gross. And my maiden name starts with an A, so they sat me right in the front. And every day I would try really hard not to pass out because I was so tired, but it's boring and you're warm and you're just eating lunch, right? So what does that mean? Nodding off a lot. So I didn't do very well in that class because I really didn't pay attention, right? So, and then of course, I get into clinic for hours, just a fun joke. The first woman I bring back, so as a speech therapist, I needed to do 35 hours of audiology clinic. So I knew about the ear, I knew how it worked, I know how hearing aids work, all that stuff. I pulled someone into, has anybody gotten their hearing tested? You know, in the booth where they test your hearing, it's quiet, right? It's an audiology booth. It's like a soundproof booth, right? And they put the headphones on and you raise your hand. So the lady sits down. It's my very first day of clinic in graduate school. I'm so nervous. I'm the first therapist. Everybody's watching through the window. And I sit this nice lady down and she tells me, I have narcolepsy, which is where you fall asleep uncontrollably. And I just looked at her and I didn't know what I was like, oh my God, small booth, quiet afternoon. And she's got narcolepsy. Like, oh my God, I'm definitely going to fail, right? So I just said to her, well, if you fall asleep, how am I supposed to wake you up? Like, can you like cue me into how? And she said, oh, tap the foot or do something. And I got an A for that day because I was quick on my feet and quick-witted and asked her how to wake her up. But I thought, oh, this is a bad omen for me. I'm not going to do well here. So I had that one. And then the other one that was really not my cup of tea is we do accent reduction. There are some speech language pathologists, and all they do is they train professional speakers to reduce accents. And to me, it's not my cup of tea. Good for them. It's good for the profession. It's not for me. I was working with one of the professors who was there on exchange with his wife. She was from Japan, and she only wanted to understand figurative language because as Americans in English, we use figurative language quite a bit, but in Japan, they don't. So she was very interested. So she was our guinea pig in the clinic, and I got her as well. I don't know why I got all these crazy people, but anyhow, I couldn't think of a way to teach figurative language. Like, how do you teach figurative language? You just pick it up, right? You either get it or you don't. And so I decided I'm going to show her Seinfeld on tape and explain to her why it's funny. And I got an A in that class too. But I never want to do that again. So that's like another area. So there's all these different areas that you don't even think of that we do, which again is why it's so fun. So cognition, we work on memory, attention to task, problem solving, organization of thought. We can give lots of different cues and compensatory strategies to help so that you can stay where you are, you can be safe in your home, and we can work together. And that can be just from like a difficulty with a brain injury, or maybe there's a disease that you have that makes you sleepy, or you have poor alertness, or also if you have some type of dementia. Oop. So good, I made a half an hour. That was my goal. So now that I've talked for that long, I want to open up the floor to ask, see if you guys have any questions for me. I mean, I could tell you stories all day long. I've had kind of a lot of stories. Yes? I never knew that there was so many different There is. And I really, everybody knows what physical therapists do, right? So I joke and I'm on a team with physical and occupational therapy, and I believe everybody has an important role. But I joke with them a lot. I said, if you can't think clearly and you can't tell the physical therapist when it hurts or what hurts, or if you can't swallow and drink water and eat, right, and you can't communicate, it doesn't matter what PT gives you to do, and I'm not knocking the PTs because I need them, but speech is more important because we've got the brain, right? So if you don't have your brain, what do you have? Like nothing, right? So that's my plug for speech therapy. We get forgotten a lot. Like we're a last, like PT, OT, and speech. Like we get left last a lot. Bye guys, no problem. Yep. So I can give you some papers, but that's why he comes on Mondays. And we have the conversation group first, speaking with intention, but we do exercises for our lips. We do exercises for our cheeks. We do exercises for our vocal folds. We slam them together to make them nice and strong. And we do breathing exercises too. That really helps. But I can give him a list to do at home. He knows. Yes.
So, I guess the question is, how do you know what you need out of the evaluation?
Okay. The evaluation, yep.
You've been diagnosed with something that could potentially
Sure.
speech.
Uh-huh.
How do you know when you need speech therapy?
Sure.
So that you don't aspirate before you recognize you need speech.
I got it. So Typically, if you have a diagnosis where there's a risk of aspiration or risk of swallowing issues, it's always good to at least get a screen done by a professional. But I always look at a couple things. Like someone might be able to eat and swallow fine without coughing. Coughing is like the big, sign of aspirating, but it might take you 3 hours to get through a meal or an hour and a half to get through a meal. So I look at timing too. So if I have some friends at a assisted living facility and they're eating at a table, and there's always that one cute little lady who takes forever, even though her swallowing is working, her coordination and her strength and her endurance is bad. So that's like timing is a big cue to me before you start aspirating. If it takes longer and longer, if you're working so much harder than normal, even though you might not be choking and you might not have aspiration or lung issue, but it's just like, we're eating again, it takes so long. If you're losing a lot of weight, if you're burning more calories eating than you are what you're consuming. And then also a lot of times with people who have like a prerequisite for aspiration, they're having some dysphagia, it's called, some problem swallowing. They just don't, they quit halfway through. So you just want to know that's like a good sign of a good screen that maybe you need to work with a professional to either modify diet or do some endurance. But if there's lack of coordination, if there's more drooling or slurring, that's not worrisome, but it's different than before. But I tell these guys all the time too, like the thing that's most frustrating about anything that you're having problems with speech or language or cognition or swallowing is if you have to think about something that you didn't have to think about before, if that makes sense. Like swallowing just used to be like you would just eat and swallow and be done. And if you have to sit and think about it or work hard, then that's a cue too also that it's impaired.
Related to that, with the changes in the sound
Mm-hmm.
of the voice.
Yes, changes in sound.
I'm not really talking about as much the
Swallowing. Mm-hmm.
but just the changes in the voice,
Mm-hmm.
and the sound,
Mm-hmm.
the clarity.
Yep.
The
Yep.
strength.
That is definitely, you can ask the doctor for a script for speech, absolutely. Because even if it's a short period of time or, I think as like patients and consumers of healthcare, we're always afraid, like maybe it's not as bad. Maybe I don't need to go there. Like when my son was, 3 months old and he got sick for the first time or 6 months old or whatever, like I was so afraid they weren't going to believe me that the kid's running 105 and he's like 6 months old. And the nurse just pulled me aside and she said, we're going to medicate him here, but we believe you. We always believe you. We will always believe you. If something's different, you are there more than I am. So if you hear like a change in voice or a change in even like nasality, like if it sounds like you have a cold all the time, but you're not sick, there's something in the back of your throat that's not as strong, and there's more air flowing out your nose. It's that thing that hangs in the back called your uvula. If that's a little bit weak, the air comes out your nose when you're talking as well, and you sound more nasal. That might be an indication that not that anything's wrong or bad, but you just need to fine tune to do exercise so you can make it stronger. Because if it's stronger, then it will be better. Yes. Okay. Sure, delayed, I'm just going to repeat so they can hear at home. Delayed speech for a young child. Right. Right. Combination of words, yep. Mm-hmm. Yep. Right. They know that. Okay. Right. Right. So that's a big milestone to hit when you put 2 words together. Sometimes they're just delayed for no reason. Sometimes if they're, and I hate to say this because my husband's a middle child, but sometimes if they're not the only child in the house and they've figured out if they don't say something, they'll get what they want anyway, like sometimes an older or younger child or a different child is talking for them and they don't have to work at it. Kids are smart that way. And if they're cognitively intact, they might figure out, well, hey, like, grandma will always give me a cookie because she's given the rest. I'm not asking for it. You just have to figure it out. But sometimes there's exercises or a way to communicate with them to help stimulate that. Maybe they had a bad experience at preschool or something, I don't know. But sometimes it just can be delay. If they're bilingual, sometimes it takes a little longer. Sometimes kids are weird and they they kind of skip over, like there are kids who don't crawl, barely walk, and you're so worried, and then all of a sudden they're running down the street. So they might not speak in 1-2 words, and then all of a sudden they're talking in sentences. That happens sometimes too. But if you're concerned, I would just have them be screened or talk to the teacher or wherever they are during the day or the parent. Just keep your eyes on it, not to create panic, but it's good to understand what's going on, and maybe you have to say, like, if you want that, you need to tell me this. Sometimes that happens a lot with like middle kids. Only children, yeah. Yep. I have an only child at home, and he's just a human, an adult spirit. He's a grown person, with everything, just because he's around us all the time. But yeah. So, any other questions? Yes. That's all right. I'm here till 2, so monopolize me.
Okay, will you explain what you do here?
Sure.
Because I know that there is some, I don't know, I'm confused.
Okay. So I'm Elise, and I come on Mondays, and I teach 2 classes on Mondays. I teach the class Say It Louder, Say It Stronger. That's at 11:30. That's a hybrid class, half online, half in person. So if you can't make it in, you can sign in. And that's all strengthening exercises and strategies to help vocal strength, but also helps swallowing too. But even if you don't have trouble swallowing, it helps. And then before that is that at 10:30, it's called, I don't even remember it. Hear Me Now. And it's, we're working on kind of a combination of language, but also some of those same things to say it louder with intent. But it's a conversational group. We like to sit in a circle or a semicircle. For whatever reason, it tends to be me and a bunch of gentlemen, which is, we have a good time. They keep me on my toes. And that's more of just a conversational, also talking about feelings, frustrations, maybe like if Rick's having a bad day, I'm having trouble with this, but I bought this thing and it helps me button my buttons. We talk about it so that other people, if you're having that issue, someone else is probably having that issue too, especially related to, you don't have to have Parkinson's to come, but especially related to that, or motor issues. And you don't have to be at any level, high, low, you can just come for kinship, it's fine. So I do that, and I took over that class from a really nice speech therapist named Maggie. She moved to Ohio. And then on Wednesdays, there's a class called Keep Your Brain Stronger Longer. Look at that. And that's at 10 o'clock on Wednesdays, and that's a hybrid class also. And that class I'm just covering for Stephanie Lamazov, and she's another speech pathologist. She's here all the time. She sees patients here. She has a private practice here, and she teaches that class. And I'm just covering her class until she comes back from maternity leave. And she comes back the beginning of September. So I'll just be here on Mondays. So I come in and I help teach the classes. I get to know the community. And for me, it's exciting because it's like a different in my day. Like it's a different thing I get to do. And these guys are really great, and I have a good time. They keep me on my toes. We talked about Olympics. What else? We talked about lots of things. Yeah. Nope, just come on in. And then they're doing a really nice thing too. They just started about a month ago, maybe. The second and the fourth Mondays, they're having a men's group. No facilitator, no therapist, no administration. They're just having a group of gentlemen who come together to talk about gentlemanly things that are related to how you're doing, right? You've been to that, Rick, right? Yeah. Am I selling it good? It's one of the members runs it. His name is Henry, and it's about 10 to 12 people, 15, I think, at the most. And they started providing lunch before, and it's just kind of like a nice time to get together and be social without picky speech therapists asking questions or correcting you or having spouses or family members interrupting. It's just the men, it's just the guys. And that you can come to that too. You can partake in everything. You don't have to have a prerequisite for anything. The Monday classes? I think you just need to sign up and be a member here, right? No? No, I won't. Maggie did that. Okay. For the Speak Out program. Okay. Was it the Speak Out or was the LSVT? Uh-huh. Okay. Yeah, I have to talk to them. I think it's changed a little bit. Yes. Okay. Okay, yes. You can come and we can work together just to kind of see where you're at so that we can get a baseline of therapy. But they didn't tell me that. So. She was on maternity leave. She came back for what, like a month, and then she moved. So I'm here to pick up the pieces. I since took that course too. I knew about it, but I formally took it and graduated from that in July. So I knew all about it. I've done LSVT before. This one is another one called Speak Out. They're slightly different. LSVT is a little bit more strict about how the classes are evolved, and it's more of like you have to do it in succession and the book. And then the Speak Out is speaking with intention, and it's a little bit different. I think that it works a little different depending on where your level's at.
Can I ask a question?
Yes, ma'am.
I was wondering about salivation. When you have excessive salivation, how do you control that with sweat?
Okay. So that's a really good question. A lot of times, and I might be thrown tomatoes at for saying this, but a lot of times the excessive salivation is not 100% excessive salivation, but weakened muscles that are having trouble cueing your swallow to swallow it down or keeping it in your mouth. So or whoever having excessive salivation, is it coming out the front of your mouth?
Oh, a dribble, yes.
Okay, so that sometimes is not necessarily, it feels like there's drooling or they call that anterior labial, like from your lips, leakage. But what that really is it's an indication that we need to work on your muscles to make them stronger so that you're able to keep the saliva in your mouth. As we age and things slow down, whether you have Parkinson's or other disease or not, the spontaneous swallows that we do without even thinking, they slow down a little bit. So you have to think more about swallowing, whereas sometimes when we're younger, we just spontaneously swallow and the saliva just stays in because our mouth is stronger. So if you are really significantly impaired by having that much drooling or anterior labial leakage, sometimes a doctor will put you on a medication to dry it a little bit. But sometimes that's uncomfortable because then you'll have a really dry mouth. Mm-hmm. So if I were you, I would get some speech therapy to make your mouth stronger first and see if that works. Your lips, your jaw, your mouth, your face, all those muscles, and get spontaneously swallowing more. So we'll pick up the swallowing. Swallowing is an interesting thing because it's like a cycle. So you don't swallow well, so you stop kind of swallowing, and then you get weak because you're not swallowing, right? So we say like, well, take away food, or some people with significant swallowing issues might even get like a feeding tube for a little while to help them with nutrition. But then when you have a feeding tube, you're not swallowing as much. So like, it's like a nasty cycle. So we got to get you working harder to get that swallowing going, so that your mouth gets stronger, your swallow gets stronger, and then you won't have as much saliva coming out, if that makes sense.
Thank you.
Welcome.
Elise, I'm here on Zoom.
Okay, sounds good.
I'm Shireen. You worked with my husband Yossi at Town Square.
Yes, hi, how are you?
Been good. I'm glad to see that you're at Parkinson Place.
Yes, yes.
I
I'm
have
still,
a
I'm still there
question.
too. Go ahead.
We continued with speech through Fox up here. We're having a
Good.
very, and she saw that Yossi really couldn't do too much with the big and loud and speak out. So she recommended, and we're using that, we're testing now the Touch Talk. That's through
Okay.
Alexa.
Yep.
What was the device you were speaking about?
So the device I was speaking about is called a UB Duo, but that's more for people who are profoundly or significantly hearing impaired. It's
Yeah.
not so much for output of voice. It's a two-way speaking device where someone has to be speedy with typing and being able to conversate, and it's just a two-way speaking device. Like, it's for people who are profoundly hearing impaired, who never got a cochlear implant, like that type of person who would need a cochlear implant but didn't get one or it failed. It's a different way. So instead of signing, it's someone who lives in the deaf community. So I don't think that that particular device would be good for him, just because you have to be able to attend and type fast and back and forth. But I like the other idea. There's a lot of other good programs out there that would be like good for him. Yeah.
Are you familiar with this product from Lingraphica?
I have seen the one from Lingraphica. Yep.
Because my speech pathologist has been using their devices for many years, and
Yeah.
that's why as soon as she after she talked to Yossi for a while, she knew that this would be good for him, and we're getting used to it. We're on week 2.
Okay.
We decide if we want it, and it's fully covered by Medicare.
Wonderful.
And he can take it with him when he goes to his outside programs.
That's great. And then he can communicate, and he won't need to wear a microphone, which he'd hate it.
No,
right?
he does not like that. He really doesn't like it.
I remember that. Yeah.
And he doesn't,
It worked, but he didn't like it. So it's only going to work if you're going to use it, right?
yeah, right. But anyway, it was very nice to see you.
Good to see you. I hope you guys are having a good summer and you want to stay out of the heat. We're going to get a big rainstorm next week. So
We have had nothing but hot weather. It's miserable, humid, and I've been staying inside in my nice air conditioned house. Only go out when I have to, and
yeah.
I'm looking forward to getting back to Sarasota in December.
All right. Well, we'll see you then.
Okay.
Anybody else? Well, I'm going to stop the recording and stop sharing my screen. Thanks everybody for coming. And I'm here if you guys need me, and they know how to get a hold of me. So thanks so much.